Good afternoon, ladies and gentlemen. We're delighted you're with us. The webinar is going to begin. I'm Steve Love, President and CEO of the Dallas-Fort Worth Hospital Council. We want to welcome you and thank you for joining this educational webinar that's hosted in coordination with BookJane. BookJane is an associate member of the Dallas-Fort Worth Hospital Council. We all know that staffing has been a key issue. Obviously, the pandemic has really stretched staffing, but even if you look short-term and long-term, the staffing needs are great, and our occupancy is still remaining high, even though, thankfully, our COVID-19 census is continuing to decline. Today's topic is solving your healthcare labor shortage. As BookJane's slogan proudly states, they've been disrupting the healthcare community since 2016. They have created an up-and-coming, innovative human capital management technology solution that helps over 700 healthcare facilities across North America. BookJane's technology allows healthcare providers to better retain, leverage their team members, hopefully reduce the administrative stress associated with staffing while driving operational efficiencies as you deliver high-quality patient care. Our guest speaker today is Mr. Michael Lee, Vice President of Operations at BookJane. This is going to be a fascinating presentation because Michael is going to discuss solutions as we work related to healthcare labor shortages, looking at a cloud-based technology to help efficiently mobilize staff. Michael has been a part of the executive leadership team for a number of years and has grown this over the past 2 years significantly as BookJane continues to grow with their innovative technology. So without further ado, we're all looking forward to this presentation, and it's my pleasure now to introduce Michael Lee.
Thanks, Steve, for that kind introduction. Very happy to be here to really share what we've learned from a BookJane front. So we do want to talk about technology and its role in how we can really help to solve the labor shortage problem, especially in healthcare. Just a little bit about BookJane. As Steve mentioned, we were founded in 2016, and really our whole goal in life was just trying to change the way we think about how healthcare professional and staff is going to be deployed. And I'll show a little bit of that later on. But I do have a couple of slides just to walk through really the problem statement and what we've seen over the last couple of years. Both pre-pandemic, this was a problem that we were trying to solve, but post-pandemic, I think, has really taken this labor shortage problem to a new level. And so, as mentioned, we work with over 700 healthcare facilities, from skilled nursing, long-term care, hospitals, to even some of the public health units across North America. We actually took some of this technology and applied it to the vaccination effort, how we sourced a lot of healthcare physicians, nursing staff to really help with the vaccination challenge. And what we really saw was, we saw that open shift fulfillment rate went into the 80s and 90%, and that actually has a significant impact on retention and really remove a lot of the barriers that we see in terms of staffing. And I'm going to show how technology can really help drive some of that efficiencies and really improve patient care, because I think ultimately that is what's going to end up mattering. And I think staffing has a huge role to play in that, as well as technology. So let's kind of start at a high level. You know, healthcare labor issues, these are global. Like, it's not unique to any region. Like, we've been in many states across the US, from California to Texas, across the East Coast, even in Canada. They're all the same. Like, we always hear, like, this is a very common theme that we see, is that, you know, insufficient staff is going to end up impacting all resident and all patient care. And so what we see is that there's a direct correlation between the number of staff and really the quality of care that's being provided. And it all goes back to really ratios and having the appropriate staff on hand, on the floors, and really doing the patient care work. That's one side of the equation. The other side is really when you look at staffing, a lot of them are burnt out. When we think about the pandemic over the last 18 months, or actually close to 2 years now, this was stuff that happened before. Like, you had healthcare workers that are working several jobs. It's heavily part-time in nature, so they're juggling their schedule between multiple jobs. They're also, the pandemic has taken a huge toll on them mentally. So we know burnout is a huge issue. And you were seeing that staff is leaving in droves, meaning even though they're entering in the profession, they're leaving, a lot of them within the first 2 years of work. And all in all, this is a scary scenario where you're seeing that the demand is going up, you're seeing that the demand and expectation for care is going up, but your capacity is going down. And so we believe that at BookJane that there's fully a role to play from a technology point of view. From a traditional scheduling perspective, this is what we see in the industry, that a lot of time is spent on administration work, just making sure that there's enough staffing for your current shift, for the next shift maybe. And while we have administration staff within many hospitals and healthcare facilities to do that, many times that leaks over to the in-charge nurse, where they're starting to do some of this administration work. And guess what? If they're doing making sure that the next shift is booked and fulfilled, guess what they're not doing? They're not providing patient care, which is what we want to get down to. And many times, not a ton of technology is being used when we're doing a call out. We're seeing that the success rate of shift fulfillment before any implementation of technologies in the 20 to 30%, not great. So you make 10 calls, maybe 2 of them end up being successful. All in all, what that does is it actually drives that cost up. And when you're stressed out and when you want to make sure that the next shift is fulfilled, you're spending a lot of time on overtime, calling the same person over and over again because you know that they will pick up overtime, as well as reaching out to external agency. And what that does is, one, it leads to inadequate staffing ratios and rising costs, but two, the hidden cost of that is really retention of key staff. So when you're not providing enough hours for your own part-time complement, they're looking for work elsewhere. And that's something that we believe at BookJane in the transparency of all work that's available, but also enabling the workforce to really effectively create their own schedule and have that scheduling happen both from the administrator and the scheduling side, as well as schedule that can be built by the frontline workforce. Just one last slide before I really walk through what BookJane does is when we think about improved resident care, we hear a lot in the industry where there's a lot of emphasis on we need to train additional nurses, additional physicians, additional healthcare human resources. And that's true. We definitely need a recruitment drive to train additional or create that workforce into the industry. That's for sure, that's real. The other emphasis we see a lot is on infrastructure. We hear a lot about the need to build more beds, to build more facility, and while that's true as well, I think what's missing is there isn't that technology to really bridge the two. So while you can build more beds and you can build more resources, both of those take a significant amount of time. You need something in between to bridge that. And if your workforce is going to double in call it the next 5 years or so, you need technology and improved systems to make that process a little bit more seamless. And our existing infrastructure from a technology point of view is probably inadequate. And so I'm going to show you in a little bit in terms of how our technology can help drive that, both in consistency of care and by doing that, hopefully improve the quality of care. And then the third component of that is really boost staffing utilization. So that hopefully that helps set some of the context. I'm going to flip over to our product, show a little bit about what BookJane can do. But what I really wanted to do towards the end, I know, Steve, we're going to open the floor up for questions. I believe there's a chat functionality. Feel free to ask during, and then we can walk through. We can really walk through. Hopefully, answer some of those questions from the audience, and then kind of go from there. So what you're now going to see, this is our BookJane product. This is effectively how our product works, and there's two sides. It is not just a scheduling tool. I think we look at technology often as just a tool for scheduling. This is a workforce optimization tool. And so the way BookJane works is that we can schedule our staff by position type. So it could be a licensed practical nurse, a CNA, a patient care aide, what have you. We also have the concept of multiple sites. So what we're also seeing in the industry is a movement towards centralized scheduling. And the reason for that, for centralized scheduling, is really because no longer do sites think about their resources on a site-by-site basis, where it tends to be siloed in nature. What we're starting to see is organizations are starting to think about their health human resources as a shared component, and that's where BookJane really shines in. And so for BookJane, not only can you schedule for your existing staff, and you can really just create a shift relatively quickly that we're pushing out, but where we really come into play is our concept of open shifts and also shared team members. So what is an open shift? An open shift really is times when you know you need a LPN for Monday, January the 3rd, but you don't know who's going to come in. And so what BookJane does is when we create these open shifts, and we can customize the time to whatever we want that shift to look like, and perhaps it's a 12-hour shift, perhaps we need 2 LPNs in that period. Maybe we want to allow overtime, or maybe we don't want to allow overtime. Once we create that open shift, what it is doing is on the BookJane application, on the BookJane app, and it's really on access through the iPhone. Once we create that shift, it is going out to every single one of these resources for a full class. Once I publish that out, they will get a notification on their phone to say, hey, there's an open shift that's available, and really looking to source. So in some ways, it is mimicking the existing call-out processes that exist, but in some ways, a little bit better. And the difference is that when we create an open shift, it remains as a open shift on somebody's app. So we're creating that transparency such that all healthcare workers, as long as within that organization, as long as they qualify for that shift, as long as they're available, they will be able to pick up that shift. So that's one way in which that we can do talk about staffing. The other component of this is a concept of shared team members. And so this is something that we pushed out about 2 years ago. It's pre-pandemic. We recognize that a big need in the industry is how do you share resources across different locations. So this could be a sister site that you're working with. This can potentially be a different department or a different ward where you're borrowing resources from different department, but creating that visibility across the organization such that as long as that resource is qualified to do that role, they're starting to see that shift that they can create. I'll show that in a little bit when I show the mobile app and how that looks like. From a shift creation perspective, this will be common in terms of most workforce management platform, is the concept of a template where we can apply a template of what a particular week will look like, and then edit the schedule from there. And so you'll see a couple of conflicts that we see. So the shift that I created previously created a conflict in terms of a overlapping shift. We can clear that out quickly simply by drag and dropping. We have a weekly overtime triggered because this particular person is working 6 out of the 7 days. Again, we can just quickly edit some of these stuff, and I'm just going to try to clear some of these off. And then publish that shift. And then once we publish that shift, what we're doing is, again, we are notifying our workforce in terms of one last one that I still have. And once I clear all those off, as I publish them, this is now going into our resources phones. We're simplifying that process of shift publication and communicating the schedule. That's really the easy part. You know, most platforms will be able to do that. One of the things that BookJane saw when we do that is, you know, expecting what will happen, you know, 3 weeks down the line or a month down the line, that's easy. That's what we expect the schedule to be. But we all know that the schedule is a living and breathing document. So, you know, a couple of use cases I'll work through, and what we see is that what happens when one of these resources, perhaps Francesca, cannot make that particular shift on a Sunday. We know that the schedule is a living and breathing document. That communication needs to happen in real time. And so if Francesca calls in and says she cannot make the particular shift, all we do is release them. We release them from the shift. Keep an eye up here on the open shift as I release that shift. And automatically we're creating that open shift such that it is going to everybody else on the team, and then eventually it will go out to everybody on the share team. So it's automatically prioritizing how that work is going to go out. The other thing that BookJane has also done is we're trying to track some of this information. So when we talk about technology, one of the beauties of technology when you're implementing it is you're starting to gather a lot of data in terms of how your workforce is understanding these shifts. So how these shifts are going out in a particular order. We can track any of that information and then actually feed our analytics tool so that we understand a little bit better about our workforce. Is there a particular shift, a particular time slot that tends to be a little bit more troublesome in terms of fulfilling? We can do a lot of that stuff from a BookJane perspective. The other thing I want to walk through was what happens if the schedule changes quickly. And so simple, we can simply edit that shift in terms of perhaps we want this person to stay a little bit longer. We can tell her a little bit about the shift to add additional notes on this, as well as notify the team member how this is going to happen, and perhaps we want an acknowledgement, and this will come in the form of an in-app notification that comes to the app, whether we want them to acknowledge the changes or we want them to actually accept or decline that shift. So we'll give them 24 hours. If they don't do anything, it will then again open up to everybody within that pool as well. So that's a little bit about what BookJane does on the scheduling front. The other thing I wanted to show before I open up the questions is really walk through our platform. So give me 1 second as I switch over to our app. So hopefully people can see my phone. This is our BookJane app. And so within the BookJane app, this is where resources will go to really access their schedule. So you see the notification up top just kind of just said, hey, here is your schedule that has been just assigned to you. You can also see all the available jobs. So remember all the open shifts that we created a couple of minutes ago. That's what comes through. And so that transparency, what we see is that when it lives on the app and when healthcare resources can really just pick up shifts whenever they want and really effectively create their own schedule in addition to their work schedule, they can really put together a schedule that works for them. in particular, what we see with your part-time and perhaps casual staff is they're starting to cobble up 40 hours a week to really create a schedule that ends up working for them. Within any of these shifts, we have the ability to filter out some of these shifts. So we can sort shifts by upcoming, when it's been created, position types, shift, whether it's a direct request, whether it's single or it's a recurring line, a particular shift length, by distance, by facility, where we can actually search up a particular location that they want to work for. And so what we see is that by doing that, by creating that transparency, no longer do you have that missed call syndrome where a workforce, and I know many stories of this, where I know of nurses that will get up at 6 a.m. in the morning because they know that's when the schedulers will do their call-ups, and that's the most frequent time. This will always live on the app as long as the shift hasn't been picked up by somebody else. So what we see is that the average workforce utilization measured in the time of average hours works per week goes up by anywhere from 25 to 40%, simply because it just lives on here. You don't get through the scenario where if you missed a call, if you missed a text, you feel like you missed a shift. It is always going to be here. So the way to pick it up, as you click on into each some of these shifts, you'll see a map. This is also integrated with your native map application. And all you have to do is really click on accept to accept that work. The other thing this application can do when we're starting to look at our schedule is availability. And so a huge problem that we see is really collecting and managing that availability of your resource. And so we've simplified some of that work via our availability function. And so you'll see a banner at the top where it says to submit your availability by November 1st. And what it's really doing is it's really notifying the worker to say, hey, please submit your availability for the next 2 weeks. And we can go all the way up to 4 weeks, 8 weeks, whatever that is. And they're really selecting what are the days that they want to see additional work. And so we're customizing and curating their experience based on what they want to be able to see. And so if it's availability, they can pick that they are available all day for those days that they choose, or they can really create a custom time to really get very granular. So perhaps they're only free before noon and after 6. You can select that this applies to some of the other days, and then really click on apply to apply that availability. And once they do that, the system is smart enough to know that we're going to notify users based on when they provided availability to us to really curate that experience and tailor it as best to them as possible. And what we see is that when we do that shift in mindset, in allowing your workforce to create their own flexible schedule, they're more engaged overall. And so those are really some of the high level things that I wanted to show via this app, and how we can really start to rethink how we can manage that workforce and manage the way we deploy that workforce in a more optimized manner. Steve, I'm going to pass it back to you. I'm sure there's questions online, and happy to answer them at this point.
Thank you very much. Really appreciate that overview. We do have a few questions that people have submitted. One question is, how has BookJane been helping healthcare facilities manage the current labor shortage crisis?
I think the way we've started to help them manage that is, I talked at the beginning about how there's a lot of focus on how do you recruit or attract more healthcare resources within the industry. How do you create more beds? Technology is an aspect that I think BookJane can really help at. And what we saw was that, and this will vary from industry to industry, but we see that anywhere between 30 to 60% of your existing staffing complement will become part-time in nature. So one of our big hypothesis was, how do we make better use of those existing resources? And by using the technology, by creating a framework and an ecosystem where workers, especially the part-time workers, can help build and add to their own schedule and really prioritize that. We found that, you know, many of our customers, actually all of our customers, increase at least 25% of their workforce utilization on that part-time staff, and some upwards of 40%.
You know, during the pandemic especially, and even pre-pandemic, providers have to do a lot of agency spending, as you know. So when you think in terms of traveling nurses, the agency spending, the big increases that we've had to pay, especially in the last couple of years, can you show how this technology helps reduce that agency spend?
Yeah, for sure. So the platform itself, what it is built to do, or what it actually tries to prioritize, is number one, all it's trying to do is make sure that each location, each site is not short-staffed at all, right? Full stop. So you'll see that when I start to create an open shift, or when I create releases on that shift, where, you know, an open shift can really be, you know, we don't have enough people in that line. Let me do a call out to my own internal primary team and to my shared teams. And then everything after that is completely automated. And so what we then do is we say that, okay, let's prioritize all of that to staff that's internal to that organization. And so what we see is that a lot of the traveling nurses, a lot of the agency use is because there isn't an effective mechanism in reaching out to that staff. So you'll see that once I create that open shift, depending on how many people are within that organization and pool, it can go up to thousands of workers instantaneously and within that organization. And it's a matter of scale. And so if you can reach out to 1,000 workers all at once, somebody's going to say yes. And so what we see is that we are increasing that internal shift fulfillment on any open shifts in the 80 to 90% range, purely just internal staff. We're not even talking about external staff. And so if you have, call it 90% of any of your open shift callouts being fulfilled by internal staff, that only leaves about 10% for agency. And that's how we start to drive down the agency costs. The agency cost is not a horrible thing. It's only a horrible thing when you start to rely on it heavily. And I think what the platform with BookJane is trying to do is help simplify a lot of that. You'll see that I created an open shift in like maybe 30 seconds, published it out. It's that whole process took about a minute. And once we start to do that, once we start to make it as easy as possible, you can really start to drive that agency cost significantly. And we see with some of our customers, agency savings upwards of 50% just by doing that. And the side effect of that is you're actually making your own internal teams a lot happier, because you're making available all the shifts that were there that they didn't even know about. And it's really about creating that transparency and that trust with those internal teams, and allowing them to pick up the work, because many times the work is there, they just don't know about it.
One of the questions someone submitted was, if you have a hospital system that has multiple locations, let's say they've got 3 or 4 hospitals, could you overlay BookJane on all 4 of the entities so that you could share staffing between the entities, or is it entity specific?
You can absolutely share across multiple entities. It really just depends on the structure. We've actually have done that, where we will work with hospitals which will have affiliations with a different hospital network, but they're really part of the same organization umbrella, and they're starting to share resources. So if you think about that, where some of these hospitals have 5,000 to 10,000 healthcare resources at one particular site, and then all of a sudden doubling that because you're working with another perhaps sister hospital, or partnering with another hospital, that is effectively your agency work. And now you're starting to share staff across multiple entities. That is something that, BookJane saw very early on, even pre-pandemic, in that why don't we just share the resources that exist and break down all the barriers in terms of how do you reach out to those resources. And so where our shared components can work is that, and I'll give it a simple illustration. It may be that Dallas Hospital, for example, has a call out. It will reach out to everybody within the hospital, within the department first, and then extending it out to that hospital. And then perhaps an hour or 2 hours later, depending on how you configure it, it is now reaching out to the neighboring hospitals that is part of that network. And now you can see how that efficiency can really scale up really fast. And that's really the beauty of technology.
Based on your experience in using this technology, we're all striving, no matter what we do or what type of provider we are, to improve and enhance the quality of patient care. Would you say you've got technology here that will help in that mission of improving patient care?
I think the biggest thing for us is, you think about the core of patient care. I think most healthcare resources are adequately trained, and what they really run up against is when they're short staffed. When it's one nurse to a patient ratio of 10 or whatever, and then it's seeing that to get worse. So what BookJane really sees and what we aim to solve is, one, how do we make sure it's not just one nurse on the floor to serve many patients, and reducing that ratio and making sure we find them help. And then two, making it as seamless and easy as possible to find that help, because the help exists, to be honest. It's just, how do you create that transparency, and how do you reduce that friction between the system, such that we can actually pull in resources, whether that's from that same internal team, whether it's from the same hospital, whether it's from a sister hospital down the street. We can do that with technology. And I think that's where BookJane can really help, is that we can ensure that each hospital is appropriately staffed, and making sure that the administration effort in terms of doing that is as minimal as possible.
You've mentioned several times at the beginning of your presentation, and this question relates to that, where you're innovative, you've got a new technology, but in your mind, how do you really consider this technology to be a game changer in healthcare?
I think it's a game changer in the way that, actually, I'll tell a story. Like early on, when we first put out this platform and we were testing it, we talked to a lot of administrators, scheduler, people who were just responsible for making sure that the floor is appropriately staffed, or my facility is appropriately staffed. And the overall main feedback was the same as what we always hear, is that we're short staffed. There's not a ton of good people. It's really hard to do that. And then everything is getting a lot harder because the demand for care is just going up. That wasn't surprising to us at all. What was surprising was when we started to talk to the healthcare resources and then the frontline staff, an overwhelming amount kind of came back and said there's not enough work available. And when we saw that as the incongruency that we saw, it was, what we really saw was that there just wasn't that transparency in there's a disconnect between when the schedulers are creating the schedule to when it actually makes it down to the frontline care worker, that there wasn't a mechanism for them to see that there was all these open shifts that were available to them. And so we know empirically now that about 20 to 25% of that schedule that you think is going to happen changes. And so reducing that, making that as simple as possible, that's the game changing part, that it doesn't leak over to our nursing and clinical teams, such that they can really get back to providing patient care. And then the other part is really, when we talk about nurses or healthcare professionals leaving the industry, because they just haven't been able to find enough work within the industry or full-time work within the industry. What this actually allows them to do is, one, reduce a lot of the administrative burden so that they're really providing patient care. What I find that healthcare professionals want to do that. That's why they got into the industry. This also helps them keep them in the industry that they love, and really help retain that workforce within the industry, because I think that's important. And having the app allow them to have that freedom and flexibility to pick up work that ends up working for them, and really creating that, it helps with that engagement aspects of it, helps creates that work-life balance that I think so many of us crave.
Here's an interesting question. Of the clients you currently have, and each client is obviously different, when they began to use BookJane, you've been through the advantages, how it helps in clinical, etc. Who do you really deal with? Clinical people, human resource people, all of the above?
All of the above, I think. I think the most part, we're dealing with the operations and HR team, and in a different challenge. I think the operations team is really looking at it and saying, how do we make sure we have the most efficient staffing operations as possible? So when we talk about quality of care, patient care, consistency of care, all of that stuff, that's what they're worried about. In that, when the active staffing and scheduling is at the top of their priority list, are there technology to really help solve for that? The HR folks that we would deal with is looking at this more from a talent attraction and retention perspective. And actually, one of the things we didn't even talk about during this is, when we talk about retention and attrition of staff and when they're leaving, it just means you have to retrain staff. And so I know of many facilities, and this is actually starting to get worse and worse, is that they're not measuring attrition in years, they're measuring it in months, meaning that they know that their staff is going to turn over. And that's just a lot of non-value added costs in maintaining your existing pool. And so what we do see in BookJane, and really when you see the app, it is trying to tailor that experience to the frontline clinicians, that they're really in and out. It's nothing more intrusive than that. We want to keep it simple. It's on the mobile app. We know everything's on the go, and we want to prioritize the experience to be as simple and seamless as possible for all parties above, so that ultimately they can get back to patient care.
Here's another question, and it's got a couple of parts to it, so let me see if I can decipher it. Does BookJane offer different packages, i.e., do you license the software to the provider? Does the provider purchase the software from you? How is it one implemented and continually updated?
Good question. And so, with us, with technology, actually, I've been in technology for pretty much most of my career. The evolution of technology and the movement into the cloud and SaaS has really been transformative in that sense. And the biggest reason for that is we want to reduce the implementation costs, both in timing, but in total dollar costs as well. And so everything that you see is really a standard package from BookJane, and we have a couple of different tiers depending on really your needs, and we can definitely take that offline in terms of what can fit your particular criteria. But getting back to the technology, it is completely SaaS-based. We can typically get up and running in about 2 to 4 weeks, and that part is a game changer, where when we talk about implementation of technology, we're not talking years in getting this up and running. We're starting to see real results within 60 days worth of implementation. And I think the point of SaaS and the point of technology is really having simple, having it light, knowing exactly how systems need to be deployed, and really creating a product that would help fit many needs.
Chris is checking to see if we have other questions. I know we've got one I see that I'm going to ask, and he's checking some more. But in your opinion, this BookJane technology, or this type of technology, would you consider it's really the future of hiring healthcare employees?
Oh, absolutely. I think even if you're not talking about healthcare, I think the expectations of the new and up and coming workforce is that flexibility and that work-life balance. I think even if you even if you don't think about healthcare, if you look into other industry, we're starting to see a movement towards the democratization of the workforce wanting to create really their own schedule. And for healthcare, it has to be, the answer has to be somewhere in between. There ultimately has to be an assigned schedule that each resources need to fulfill, or each frontline worker needs to fulfill. But there's still opportunity for them to pick up additional work, and they want to. And that, when going back to my story, and that when I talk to many different healthcare workers, and there's not enough work available within this particular location, what they're really talking about is, I'm part-time of nature. I'm not guaranteed all these hours, but I want to work more. And I think what this technology is able to do is really completely open that up for that workforce, such that if they want to work, there is plenty of work that's available, and they can pick and choose the work and the shift that makes sense for them.
Well, Michael, I got to tell you, this has been a fascinating discussion. Chris, is that all the questions you see at this point?
Looks like that's all of them.
That's all of them? Okay. Well, Michael, we certainly want to thank you for this excellent presentation. Thank you for explaining the BookJane technology. And we do agree with you. Anything we can do to help our human resource people, our clinical people, manage their workforce more efficiently, and at the same time give more satisfaction to the workforce, then that's going to be a good thing. So on behalf of all the people on this webinar, thank you for an excellent presentation.
Thank you so much, Steve. It was a pleasure.
So, ladies and gentlemen, this will conclude our webinar. We want to thank you. We appreciate your interest. And Chris will be making this available, I know, also probably tomorrow.
Yeah, it'll be online tomorrow.
Yeah, it'll be online tomorrow if you want to share it with some of your colleagues that may have missed it. So we hope everyone will have a good afternoon. Thank you.